This is Doug Brunk reporting from the Summit in Aesthetic Medicine 2012 in Dana Point, California. Dr. Lisa Donofrio discussed her experience using frozen fat for facial volume restoration.
In my hands, the most important thing is sequential fat transfers. So I tend to volumize over time. Maybe a typical case would be a total of 6 fat transfers over the course of 18 months or so. And I think that seems to be the key, is this slow, gradual augmentation, whether it's with frozen or fresh. It's difficult then, certainly in that situation, to get a patient to commit to 6 fresh fat transfers, since they would have to go through the harvesting or the liposuction every time. So part of what I'm observing is this re-fat transferring in the same patient. And I don't have a magic crystal ball, so I really don't know what's happening under the skin. I can just tell you that in my experience over the last 15 years with fat, most of it's been with frozen fat, and I see a definite trend towards very predictable longevity in those patients. About 5 years ago or so, frozen fat came under such criticism when people started culturing previously frozen fat and looking at previously frozen stem cells and looking at viability as a parameter, that I felt the need, as somebody who wants to stay current of evidence-based medicine, to transition my practice over to only fresh fat. But the patients who had gotten frozen fat previously and had good longevity, say 10 years or so, were more inclined to request frozen fat again rather than fresh fat. And for that brief period that I did try to transition out, I really didn't notice any increase in what I was seeing as longevity or maintenance of results than I did with using the sequential frozen fat. Does freezing the fat affect whatever is leading to long-term augmentation? So in the some of the current thinking, frozen fat may be a scaffold. There may be cytokines in the frozen fat which lead to preservation or awakening of senescent fat cells that are indigenous to the face in the area of transplantation. There have been some studies that looked at viability of fat, and the longer the fat is frozen for, the less cells were able to be recovered that were viable. But since we're not really talking about viability, I don't know how freezing affects long term. In my own experience, which again would be anecdotal, I freeze for 2 years, and I haven't really noticed in that time period a difference in that if the patients use their frozen fat in 6 months, it's better than if they use it over 24.